Okay, so we are back here for this last section of chapter 1 on basic anatomical terminology. And this section of the lecture is important for you not only because we're going to use these terms for Bio 201 as well as Bio 202, but they'll also be important for you because these are the terms that you're going to hear professionally used. So again, these are the terms that you will use hopefully throughout your health professional career, and you'll find them to be very useful. So again, getting a good it's like learning a foreign language, right? So if you can get a good grasp on these terms now, it makes it so much easier later on. They just become kind of second nature to you. So as we go through these anatomical terms, always, 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 we are going to be using these terms in reference to the body in anatomical position. So anatomical position, and let me go ahead and get my pointer on here. So anatomical position is always going to be with a person standing flat on their feet, face forward, palms up. That's the big key factor there is palms up, right? Because the rest of it kind of makes sense, right? When you're talking about things from anatomical position, body erect, right? That makes sense. You're standing up, feet flat on the floor, slightly apart, arms at your sides. But the key thing that you have to remember, because we don't walk this way, right? We don't walk with our palms facing forward. So it's goofy to remember that anatomical position is with your palms facing forward, because it's not how you find a person walking down the street. But that is the position in which we are always going to make references from. So make sure that you remember, hint, hint, this last one, palms facing forward with the thumbs pointing away from the body, because this is the one that always gets students. Okay, especially when we're talking about things like medial towards midline versus lateral. Again, you have to know that the palms are facing forward. That's from anatomical position to know that the thumbs are going to be more lateral. We'll get to those terms in just a minute here. Okay. So again, anatomical position is just a standardized kind of position that we can use to observe the body, to image the body. And it's important that you remember that when you're referencing the human body from anatomical position, you're referencing that person's anatomical part, right? So when you're looking at that person, if this person's standing in front of you, right? Then you might say, oh, okay, well, I'm looking at this arm, which is, on the right side of me. But it's not her right arm. This is her left arm, right? So make sure that you're using the term. It's not about you, right? It's about your patient. So you learn that early on. So it's about, again, their arm, not what it looks like to you. So again, this is their left arm. This is their right arm. So you have to kind of keep that in mind as well, okay, from when you're talking about, anatomical position. Now, there are some other positions that we use, and you use them more medically. I'm sure everyone knows what proning is now because of COVID. So it should be pretty easy to remember the prone position. This is also the position in which my husband falls onto the bed at night after, he's exhausted. And some people can sleep this way. I cannot, but prone position is how I often find him. And so you may have a spouse that sleeps that way as well. So prone position is lying face down. So that's prone. And then if the body is supine, then you're lying face up. So these terms will be important to know because we're going to learn things like pronation and supination when you're talking about movements of the wrist. And so it will be important to associate prone with face down, okay, and then supine with face up, because we'll talk about that again with the palms. When you're doing supination, the palms will be face up, and pronation, they'll be down. So again, face down, prone, face up, supine. Excuse my dog in the background there. So hopefully those are some easy terms for you to remember. Directional terms. We're going to use these directional terms. These terms you are going to want to be really familiar with because we will use them throughout the semester. We will use them throughout 202, and you will definitely use them in your professional career. So directional terms are going to be used to describe one body structure in relation to another body structure. And of course, it is always from the standard anatomical position when we are making these references. Again, right and left refer to the body being viewed, not right and left of the observer. So again, it's not about you, right? It's about the patient. So some of the terms that you're going to use are superior, inferior, proximal, distal, lateral, medial, and we'll throw in a couple other terms here. So these are just a few of the terms. The reason I have this slide is to just remind you that when you're doing anatomy, anytime you can lump things together to help you learn the information, it makes it so much easier. So as you learn these terms, you're going to see, proximal and distal are just the opposite of each other. Same with lateral and medial, same with superior and inferior. Learn them together because as you learn those together, it will decrease the amount of information, right, that you have to learn if you're kind of learning these two together as opposing terms and these two together as opposing terms and these two together as opposing terms. It seems less daunting to kind of learn these three directional terms together, as groups, these three groups, versus learning all six terms, okay? So just a little trick in terms of learning your anatomy, anytime you can group. Grouping is better. So let's start with, real quick, I'm going to start with superior and inferior, and then I'll move on. But superior and inferior are going to refer to, and the easy way to think of this is the actual, you guys probably know what superior and inferior mean, just as general terms. So you can think of superior like you're, more superior than someone else higher up. So that's what superior means, higher up. And then inferior, if you're more inferior to someone, lower down on the caste or whatever. So back in the, medieval times or whatever, hopefully we don't have caste systems right anymore. But then if someone was more inferior in the caste, right, they would be lower down. So inferior means lower. So hopefully that will help you to remember those directional terms, even though thankfully there are no caste systems anymore, right? We hope, at least not here. And so when we are talking about superior versus inferior, remember that we're using these as directional terms. So, the head is going to be more superior than, than your leg. Okay. And the leg would be more inferior than your head. We use this more often with, things like the heart would be more superior to the intestines, and the intestines would be more inferior than the heart. Okay. So again, just a kind of brief introduction there. We also use the terms anterior and posterior, or dorsal and ventral. This is where I'm going to go to this chart because I wish I had done that slide just a little bit differently, in that I wish I had done the slide like this, where you've got them in kind of parentheses, because anterior and posterior are going to be the two terms that we use more frequently in human anatomy and physiology. Dorsal and ventral will also be used, but we use those terms more with animals. So when I teach marine biology, I use dorsal and ventral quite frequently. It's also just typically used with organisms that are quadrupeds versus bipedal. Anterior, posterior, again, used more with bipedal organisms. So, but you will see that they kind of switch, and they'll go back and forth, and they'll use dorsal and ventral, especially in the nervous system. So it's good to know both terms. So anterior is going to mean towards the front of the body, okay? Or you can also say ventral. To make this easy, think anterior, ventral are both belly side. So whether you use anterior or ventral, they both mean belly side. posterior or dorsal mean backside, okay? So typically, again, if we're referencing things on the body, we will use anterior and posterior more than dorsal and ventral. Dorsal and ventral will be used with just a few of like the actual structures, like in the nervous system, like we talked about. So again, when you're going to use these terms, just to give you an example, you might say the brain is posterior to the forehead, right? Or the forehead is more anterior than the brain. So again, the brain would be more posterior and the forehead would be more anterior. Or again, you can do dorsal and ventral. So obviously, again, here the forehead would be more ventral and the brain would be more dorsal. Okay, so again, just kind of getting used to these terms. I know it's a lot of learning a new language all at once, but you'll get really familiar with these. By the time you get to 202, these will be second nature. So again, ventral or anterior are at the front of the body. So the sternum is anterior to the heart. So, or you could again say that the heart is posterior or just at the back of the sternum. Okay. So again, those are those anatomical terms: anterior, posterior, dorsal, ventral. And like I said, if you're talking about your, dog or some quadruped, you'll hear dorsal and ventral used more in like your vet offices and things like that. Medial or lateral. So again, medial just means easy, super easy, towards the midline, medial. Lateral means just like it sounds, lateral, away from the midline. Okay. So these are pretty easy terms to remember. For example, an example of this would be the heart here lies medial to the lungs, and then the lungs out here would be lateral to the heart. Okay. So just an easy, or, you could do it with your, your nose would be medial to your ears would be lateral to your nose. Okay. So again, lateral meaning farther from the midline. And I put this on here because a lot of times, again, people forget we're always referencing from anatomical position. So anatomical position being palms facing forward, thumbs out, right? And so the thumb is actually on the lateral side of the hand. And so this is hard to remember, if you're thinking about how you're just walking down the street, it's hard to remember that that would be lateral. But if you remember, we're always from anatomical position. So this one is a tricky one. And this always is the hang up, hint, hint, for students on an exam, because we typically put this question to make sure that you know that anatomical position is palms facing forward. So there's your hint, hint for the exam. Proximal or distal are going to be used with the limbs. And the reason that we use proximal and distal for the limbs is that it's harder to kind of gauge superior and inferior on the limbs because they're kind of at an angle, and also the limbs move. So, if your hands are held up, it's hard to tell what's more superior, right? Because versus inferior if you have your hands raised up. So for the limbs, we use what's called proximal and distal, and we use this in terms of the proximity to the trunk of the body. So if you're closer to the attachment point or the proximity of the trunk of the body, so that's why I use proximal, proximity to the trunk, then you're closer to that attachment point to the trunk of the body. So think of proximal as closer proximity to the trunk of the body. And then their distal would be farther from that attachment, okay, to the trunk of the body again. So when we use these terms, we use it in terms of, again, 2 points on the limb. So you might say that your shoulder that shoulder joint is more proximal than your elbow joint, or your wrist here is more distal than the elbow joint. Okay. Or you can do the same thing here. Your knee here is proximal to the ankle joint, or your hip is proximal to the knee joint. So again, you know, they're going to change depending on which 2 points you're referencing on each limb. So hopefully that's fairly simple. And so all of these orientation and directional terms are put in this nice table for you. And it's always a big clue that something is really important and you should know it, hint, hint, for the exam if it's put in a table. If the publisher took the time to all organize this and format this and put diagrams into a table for you, then it's because it's critical information for you to know. Okay, so we have superior and inferior here. They do, in parentheses, put cranial and caudal. Cranial would be used more than caudal. We don't use caudal much. Again, because cranial, again, is referring to, again, the head cranium. And caudal is referring to tail. And because we don't really have a true tail, we don't use caudal. Now, in marine biology, caudal is used all the time. We talk about caudal fins, which is your tail fin. But here in anatomy and physiology, we just don't use caudal very often. So you're going to see superior and inferior used. You'll see cranial. You'll hear cranial used sometimes. So cranial and superior both mean, you know, towards the head end, and then inferior is going to be towards, again, the lower portions of the body. And so they give you a couple examples. Again, the head is superior to the abdomen, the navel is inferior to the chin. So again, those are, just because I didn't have a slide specific for superior and inferior, I thought I'd spend a little more time there on that. But again, cranial would be a term you know, but caudal, you really just won't hear caudal. Anterior and ventral, again, as a reminder, means towards the front of the body, or I think belly side, okay? And then posterior dorsal backside. Medial and lateral, again, medial towards the midline, lateral away from the midline. Intermediate, we don't really use, again, so much, you know, it's kind of the spot that's between a more medial and a more lateral structure. So if you have a really medial structure and a lateral structure, then, you know, you could say it's intermediate. So the collarbone is intermediate between the breastbone here and the shoulder. But you just won't hear intermediate as often as well. Proximal and distal, you definitely need to know. Again, proximal closer to that attachment point to the trunk of the body, distal farther away from that attachment point of the body. And then the last 2 terms are superficial and deep. Superficial, again, external, sometimes you'll see used in some of the histology. So external would be, again, more superficial towards the surface of the body. So the skin, an example that would be the skin, is superficial to the skeletal muscle. This is pretty easy. And then deep is obviously going to be deep to the skin. So away from the body's surface, more internal. So again, the lungs are deep to the skin. Okay, regional terms. So there are 2 major divisions of the body, especially when you're talking about the skeleton. We have the axial skeleton of the body, the axial portion of the body, which is going to be the head, the neck, and the trunk of the body here. And then we have the appendicular portion of the skeleton. The appendicular portion is just kind of like it sounds good. They're going to be these limbs, okay? So appendicular includes your limbs or legs and your arms. And then also what attaches that to the body, which would be the pelvic structures here that attach the lower limb to the body, as well as here the scapula and the structures, again, that are going to attach the upper limb. So those are just some basic regional terms to know. Again, axial, head, neck, and trunk. Appendicular is going to be referring to your limbs. And then here are just some more specific terms to know in terms of regional terms for the body. So you want to get familiar with these terms, again, not just because they're going to be terms that we use in anatomy, but also because they're going to be terms that you're going to hear in your health professional careers. Those of you that are already out in hospitals and things like that are probably already familiar with many of these terms. So cephalic is just going to refer to the head region. And then you can break kind of the head region up into some of these other smaller regions. So the frontal region here, it would be kind of like the forehead type region. Orbital region would be like around the eyes, the orbit around the eyes. Nasal, pretty easy. Oral, here around the mouth. Mental, you guys will learn something called the mental foramen, which is right here around the chin. So knowing this area is kind of the chin type region here is called the mental region, will help you remember that foramen later on. Cervical being the neck, thoracic being the chest area. And then you could break this up into like the sternal region where, you know, your breastbone, the sternum is. Axillary, underneath your armpits is axillary. Mammary, again, around the breast region. Abdominal region here would be kind of below what you're going to learn is called the diaphragm. Umbilical, obviously, again, around the belly button. Pelvic region here would be the area that kind of contains the bladder and the reproductive organs. Inguinal regions would be kind of in the groin regions here. We refer to those as inguinal. Pubic region would be, again, your genitals specifically. And so some of these terms will be helpful for you, especially when we get to learning a lot of the blood vessels like the axillary artery and things like that. These inguinal arteries, these terms will be really helpful for you to kind of remember these as you're going through. Again, so you can go through these. Acromial is going to be this kind of shoulder region. And this will help you again when you're learning some of the bones here. Brachial is going to be this kind of upper arm region. Antecubital would be right kind of in the crease there where your elbow is. This is oftentimes where you have blood taken. So antecubital is this area. Antebrachial would be the forearm. Carpal is the wrist. Palmar is the palm region. Pollex is going to be your thumb. Digital would be your fingers, other than the thumb. Lower limb, you've got coxal. When we talk about the coxal region, that's the hip. Femoral is the upper thigh. Patellar is the knee. Crural is going to be referring to the lower portion of the leg here. Fibular would just be along where the fibula is on the outside of the lower leg here. Pedal is going to refer to the foot. So we talk about pedal, foot. Tarsal is referring to the ankle here. Metatarsal would be this kind of portion of the foot here. And then digital would be your digits, your which we'll learn, I guess you guys haven't learned that, but your the digits here will be your every toe except for the big toe. The big toe we'll refer to as the hallux. So, and then you can go to the posterior side and again, kind of go through some of these same terms. Some of them will be the same, like the antebrachial region here and the brachial up here in the upper arm. And then some of them will be different. So here, instead of the antecubital, you're going to have the olecranon region. So that's going to be like where your elbow is. Manus is going to be the hand. And again, you have metacarpals and digits. The lower limb, you've got, again, the femoral region. This is going to be different. The back of the knee is going to be referred to as the popliteal region. And that's important to know. Again, we're going to have blood vessels that are going to be named after this. Sural is often referring to the calf region. Calcaneal is the heel. Plantar is going to be the bottom of the foot here. Perineal is between the anus and the external genitalia. So we call that the perineal region. Gluteal region here, you're probably familiar with. Sacral region here. Lumbar region you're probably familiar with, vertebral region, scapular, where the scapula would be in the kind of back of your shoulders there. So again, those are just some terms to get familiar with. And again, we'll use these terms throughout Bio 201 and 202, so we're just trying to get you to familiarize yourself with them now. Planes and sections. Planes are going to be these imaginary flat surfaces that are used to divide up the body or organs into these kind of defined areas. And we'll use these in anatomy and phys, but you'll use them quite a bit in terms of when you're doing, if for some reason you're looking at imaging of the human body, so an MRI or an X-ray, and then especially if you're going into any of those fields, then you really need to be familiar with these different types of sections. So we're going to talk about sagittal plane, we're going to talk about frontal or coronal plane. Again, there's two terms for the same thing. I know that it seems like we're just trying to confuse you by giving you two terms for one thing, but you want to be familiar with both because you'll hear both used, both frontal and coronal plane used. Same with transverse and horizontal. Okay, so let's look at these different sections. And when we talk about sections, we're just talking about these flat surfaces kind of resulting from cutting through the body. Not always physically cutting through the body, but like cutting through the body again when you're taking an image, oftentimes. Hopefully not physically, unless you're looking at the Body World exhibit here. So if you've seen the Body World exhibit, this is the sagittal section, a person, where they took this person and broke them up into all these different sagittal sections. So sagittal sections is going to divide the body up vertically into right and left parts. And so you can see they just took multiple sagittal sections here, which is pretty interesting from an anatomical standpoint to see all these different sagittal sections of the body. So again, the sagittal plane is going to break the body up into right and left parts. That's the big key here, right and left parts. And when we talk about a mid-sagittal plane, this means the cut is made perfectly on the midline. So we call that mid-sagittal. Parasagittal, which would be any of these cuts here, are just saying that it was cut off-centered, so not on the midline, but still on the sagittal plane. So we also can have what's called the frontal or coronal plane. So again, frontal or coronal, same terms. Frontal is probably easier to picture because you're basically taking a cut and dividing the body vertically into an anterior and a posterior part, or front and back, okay? So remember, anterior would be front, posterior is back. So here would be an MRI that's through a coronal or frontal section here. So, and I put this one just because it was kind of interesting. There's a large brain tumor here. So it's important, to know that you're looking at a a coronal section here, not sagittal, sorry, because again, a sagittal section would be right through here. But it's important to know that you're looking at a coronal section here, so you know that this is, superior and this is inferior. And so here, the tumor is on the inferior portion of the brain here. So again, just kind of interesting to see these different sections. And then as obviously for this brain tumor, they would take multiple coronal sections in terms of doing the MRI. And that is to make sure that, they can get the exact placement of the tumor. So where is that tumor in terms of how far it goes towards the anterior versus the back posterior here. So you would take multiple coronal images there. Then you have a transverse or horizontal plane. So again, the transverse or horizontal plane is as if, this is where I have such a hard time teaching this lecture without using my hands and you guys not being able to see me. But it's basically if you were to cut across the body transverse, right? Or horizontal. So if I'm looking at, which is what we're looking at here, transverse or horizontal section, it's going to be cut this way. So it's like you've cut off the top of the head and you're looking into the brain, if that makes sense. Okay. So this is going to divide the body horizontally into superior and inferior parts, okay? So top and bottom are superior and inferior. So this section here would be like literally if you would just cut off the superior portion of the brain and you're looking into it, okay? And you can see there's a large brain tumor here. I just put some kind of interesting images for you. And then an oblique section is just any cuts that are at an angle other than 90 degrees to the vertical plane. So as you can guess, oblique sections aren't quite as popular. They're not used quite as often. More used probably in anatomy than anything. So again, these are some nice images to show you again the difference between here, that sagittal plane. So remember that sagittal plane is going to cut the body into left and right parts. So you can look at an image of the sagittal plane here. And then here, the frontal or coronal plane is going to section the body into the anterior and posterior parts here. So you can see all the organs really well here in this coronal plane. And then the transverse or horizontal plane here is going to break the body into superior and inferior parts here. So it's like you're kind of cutting off the top and looking in to the body. So here are some MRI images of the head. And so I ask you, what kind of section is it? So this one, you should say horizontal or transverse section. This one here should be sagittal. So you can see here, again, you're breaking up the body into that right and left parts. So here you can see the nose and the mouth. And then this section here should be pretty easy to see that it would be a coronal or frontal section. So again, breaking up the body into the anterior versus posterior. So you'd be, looking into the anterior portion of the brain here in this section. So again, hopefully that was just a fun way to kind of get you to recognize the different sections. Again, transverse horizontal, here sagittal, and then coronal here. So now we're going to talk a little bit about body cavities. And body cavities are these spaces within the body that kind of help protect and separate, also support some internal organs. And so we need to be familiar with these body cavities. And some of these cavities are really important for providing protection to the organs that are within them. So we're going to talk about how these cavities do that. So there are two sets of cavities. There's the dorsal body cavities, and then there's the ventral body cavities. So the dorsal body cavities are going to protect mainly the nervous system, the brain, and the spinal cord. And so we'll break them up into those subdivisions based on that. So there's the cranial cavity, which is going to encase the brain, and then the vertebral cavity, which is going to encase the spinal cord. So here you can see here's the cranial cavity, and then here's the vertebral cavity, protecting the spinal cord. So those are those two major subdivisions. And then we can break up the body into the ventral body cavities. These ventral body cavities are going to house the majority of the internal organs. And so those collectively, when we talk about organs, the term for organs is viscera. And this is a term you're going to want to get to know. In marine biology, I helped my students remember viscera and visceral mass was organs. And so I always would tell them, like, in terms of, my students always would ask me, have you ever tried escargot? Or, do you like to, eat calamari? And I would always tell them that I'm really not a big eater of visceral mass. I don't like to eat visceral mass. Don't like to eat viscera. So if it's got a lot of organs in it, I'm not a big fan. I know there are people out there that do, and I am not knocking eating organs. Viscera are so good for you, but can't eat the viscera. So anything like your escargot or sea cucumbers, things that you're eating, mostly internal organs, viscera. Okay, so associate that viscera with organs. Not sure if my story helps you or not, but hopefully I try to give you these little things along the way that can help you to remember these terms. So the two subdivisions for the ventral body cavities are going to be the thoracic cavity and the abdominopelvic cavity, which you can then break up into the abdominal pelvic cavity. We'll talk about just a minute, just to make it more confusing, right? So let's first focus on the thoracic cavity. The thoracic cavity, if I can go back for a minute, I'm going to go back to this. The thoracic cavity is basically this cavity that's going to include the heart and the lungs. Okay, so that's all the thoracic cavity. The thoracic cavity is all of this. Now we can break up, I shouldn't say break up, but within the thoracic cavity, we have pleural cavities. Pleural cavities are going to be a serous cavity. So I'm going to come back and talk about these in just a minute, but I'm putting them underneath here so you know that the pleural cavities exist within the thoracic cavity, because this tends to really confuse students, the thoracic cavity versus the pleural cavities. So there are these pleural cavities that surround each lung, okay? Within the thoracic cavity, so cavities within cavities, there's the mediastinum within this thoracic cavity, and that mediastinum is going to contain what's called the pericardial cavity. The pericardial cavity is going to be this cavity that surrounds the heart, this serous cavity that surrounds the heart, and we will talk about that in just a minute. And so again, that pericardial cavity encloses the heart. So when we talk about what is within the thoracic cavity is going to contain the heart and the lungs. So the thoracic, if you see something marked that's like this, it's not the pleural cavity, because the pleural cavities are going to be just surrounding the lungs, and they are within this big cavity that we call the thoracic cavity. Okay? So this whole thing's the thoracic cavity. And so I'll come back and talk about the pericardial cavity and the pleural cavity that lie within this big thoracic cavity. Okay? So hopefully, again, that seems to really confuse students. So I am hoping that by showing you that might help ease some of the confusion there. So now we're going to talk about the abdominopelvic cavity. That's this big cavity. And again, of course, the abdominopelvic cavity, just to make it more complicated, right? We're going to break it up into the abdominal cavity and the pelvic cavity. The easy way to remember what's in the abdominal cavity is to know what's in the pelvic cavity, and then just remember that the abdominal cavity is everything else. So the pelvic cavity is going to contain the bladder and your reproductive organs and the rectum. Okay, that's it. So bladder, reproductive organs, rectum. That's it. So if you know what's in the pelvic cavity, then all the rest of the digestive stuff is in the abdominal cavity. So you're talking about stomach and liver and small intestines and large intestines, pancreas, spleen. All of that is going to be within the abdominal cavity. Okay, so again, this is just, this will kind of go back. Sorry, I get caught up here. I really probably already covered all this, but again, there's the abdominal cavity. It contains the stomach, intestine, spleen, liver. And remember, it's just easy to remember what's in the abdominal cavity by just ruling out what's in the pelvic cavity. So again, pelvic cavity, urinary bladder, reproductive organs, rectum. Hopefully that helps. Okay, so those are the body cavities. Please let me know if you have any questions. I'm coming back. I'm going to circle back to these serous cavities, which are a little bit different, okay? So I'm coming back to the pleural and the pericardial cavities, also the peritoneal cavity in just a minute here. So just as kind of a fun, like clinical addition here, when you're looking at the pelvic bones provide some kind of limited protection, right, to the pelvic cavity. But the walls of the abdominal cavity are going to be primarily formed by muscle. And so the organs in this area are a bit more vulnerable to trauma than the pelvic region. So again, this is where you see a lot of trauma in terms of car accidents and things like that, with evisceration of the intestines and things like that. And again, part of that is because that abdominal cavity is primarily just protected by, again, muscle. So now let's get into these serous membranes. So these serous membranes, if you look here to help you remember how to spell it, these serous membranes are very serious, but without the I. So these serous membranes are also called serosa, as the plural, are going to be these kind of double layered membranes that cover the surfaces in your ventral body cavities. And so they're going to have kind of these it's double layers, 2 layers. They're going to have a parietal layer that's going to kind of line the internal body cavity walls, so the actual cavity walls. And then they're going to have the visceral serosa, right? Which is going to be viscera, organ. This is going to be the layer that's going to line and cover the internal organ. So this will be the layer that kind of acts like saran wrap that's going to like wrap right around the internal organ. And so in between these 2 layers, the visceral layer and the parietal layer, is going to be this fluid, this serous fluid. And the serous fluid is going to be this kind of gelatinous-like fluid. And that gelatinous-like fluid is really important to help reduce friction. So we're going to have these serous cavities and these serous membranes around organs that are moving. So for example, the heart is constantly beating, right? And so as that heart beats within inside its cavity, you don't want it like rubbing up against, bones and things like that in the cavity, in the pericardial cavity. So it's going to have this serous fluid, this double layer membrane, the pericardium, with serous fluid in between to help reduce friction so that heart isn't being damaged as it beats. Okay, same thing with the lungs, right? The lungs are constant breathing in and out. And so, your lungs, if they didn't have this, what's called the pleura are going to be the serous membrane that lines the lungs. If they didn't have the pleura and that nice gelatinous fluid in there to protect them, the lungs would constantly be damaged by the ribs, right? They'd be rubbing up, friction every time you breathe in and out. So these serous membranes and the serous fluid in between is really, really important for these lungs, for these organs like the lungs and the heart, so that they don't sustain damage as they are moving. And then the same thing's going to happen with our abdominal organs as well. And so we'll call that the peritoneum. So let's go through these really. We'll get into the nitty-gritties of each one, and then I'll kind of show you some images, which I think it's a little easier, again, to see some images. And if I had you in lecture with me, I would have a balloon, and I'd take my fist and put it through the balloon. But anyway, I may do a separate lecture, a separate short video for you on that. So when we talk about the pericardium is a serous membrane that lines the heart, which means that you have a visceral layer and a parietal layer. So there's the visceral pericardium, which is going to be the membrane that lines right directly around the heart, and then the parietal pericardium, and in between the visceral and parietal pericardium is going to be this serous gelatinous fluid, this gel-like fluid, right? And then same thing with the pleura. So the pleura is this double membrane, which means that you have the visceral pleura membrane or visceral pleural membrane, and then you have the parietal pleural membrane, and in between you're going to have serous fluid. And then for the abdominopelvic cavity, you have this one big membrane covering all these abdominopelvic organs. And so this is called the peritoneum. And so that way then, as food's moving through your digestive tract and things like that, you don't have those organs in your intestines rubbing up against the abdominal wall, right? So the peritoneum is going to be this double lining. Again, you're going to have the visceral peritoneum that's going to line the organs and a lot of your digestive organs. And then you're going to have serous fluid and then the parietal peritoneum. Okay. So let's talk about each of these specifically. So this here is a really nice diagram of the pericardium, okay? And so when we do go through this, here's this double membrane. And if you could picture, it's like your heart is like your fist. And if you were to take your fist and punch it into a balloon and the balloon didn't pop, right? You could fit your fist into the balloon. So again, your fist is the heart here. And the part of the balloon that's right around your fist is actually going to be the visceral pericardium. So again, that's the layer, the membrane that is right around the heart, right? It's right around the heart. So this would be the visceral pericardium. And then here, this layer out here would be the parietal pericardium. And the space in between here is what we would call the pericardial space. And that pericardial space is what's going to be filled with serous fluid. Okay, so it would be filled with this gelatinous fluid. So I love this image of the fist being thrust into a balloon because it really, I think, is the best way to give you this visual representation of what the visceral and parietal layers of these serous membranes look like. Okay, so again, you can see the visceral pericardium here, right around the heart, the organ, the viscera, and then here, the parietal pericardium on the outside, and then this space in between is the pericardial space with that serous fluid. Pleura. So when we talk about, again, the pleura, here is the lungs here, and then right around the lungs, right directly surrounding the lungs, would be your visceral pleura, okay? So, and then you would have this space, okay? And then you would have, here, let me show you that this isn't really shown very well on here, but this would be, the nice part about this is your transverse section here. And so again, this would show your visceral pleura is literally going to be like saran wrap lining the lungs. So here again would be that visceral pleura right here, right? And here's that nice diagram. Here would be the lungs, right? So there's that visceral pleura. Here's the visceral pleura. Here would be the parietal pleura on the outside here. So parietal pleura. And then the space in between here is called the pleural cavity. So here, if I could write this in, hold on one second, because I know you have viscera. I don't know if you guys have pleural cavity anywhere in this lecture, so I'm just going to go ahead and write it in. I'm horrible with, just so you know, with writing in here, so I'm going to do my best. But this would be the pleural cavity. So here, that cavity in between the visceral pleura and the parietal pleura is called the pleural cavity. And again, what is that pleural cavity filled with? You got it, this gelatinous serous fluid, okay? Okay, so let's go on to the next one. Here, this one is just the peritoneum. So here now you can see that we have the visceral peritoneum, which is going to line all of these internal organs. And so all of these digestive organs. And then the outer layer here, you can see right here, is the parietal peritoneum. And that parietal peritoneum covers all the way around here. And then in between the visceral and the parietal peritoneum is, of course, the peritoneal cavity. And that peritoneal cavity is, again, filled with a serous gelatinous fluid. Now, what's cool is you're going to learn in 202 about the falciform ligament here, which will attach to those peritoneal layers. So, but you'll get to that in 202. But anyway, you'll maybe remember this back in 202. So those are your serous membranes. And just as kind of a clinical reference here, your serous membranes can become inflamed and infected. And usually if they are inflamed, it's because it's as a result of an infection. So those smooth layers can actually get rough and even kind of stick together. And this results in quite a bit of pain. So some examples of this would be pleurisy, which would be, again, an infection and inflammation in the pleural cavities. Or in the pleural membranes. And then peritonitis would be inflammation in the peritoneal membranes. Again, oftentimes due to infection. Okay, so let's get on to, I know that there's a lot of anatomical terminology here, but I'm going to try to get through this as quick as we can. So the abdominopelvic region is actually oftentimes broken up into quarters. We break it up into the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. If you have ever taken like an EMT type course, you've used these terms because this is typically what you'll use these quadrants in reference to where there's pain or bruising. If you came on, onto the scene of a car accident, you could say that there was bruising in the right upper quadrant. And that's, again, concerning because you in the right upper quadrant, you have the liver. That's an organ that you don't want to damage, right? So you've got the liver here, the gallbladder, and then some of the large intestine here. The left upper quadrant here will contain things like the stomach and then and some intestines. Here, the left lower quadrant, again, mostly intestines, small intestines here, and then some bladder. And then right lower quadrant, you've got the cecum, the appendix. So pain in the right lower quadrant is always kind of important to note because you have the appendix there. So again, those are just, you usually use the, umbilical region to break up the quadrants here. And that way then you can break them up into these 4 quadrants. That's honestly, these 4 quadrants are probably used most. Now, in anatomy and physiology, we will break them up into these 9 regions. I'm going to mention them, but again, I don't use these as often because, you're really breaking up organs here. So, for example, here, as you break up these regions, you can break them up into these 9 different quadrants. The right hypochondriac region, and then the left hypochondriac region here. Again, the reason I don't think that these are used medically as often is because, you've got part of the liver in the right hypochondriac region and part of it here in what's called the epigastric region. So, but I'll just briefly mention them again. For me, I'm not going to test you on these regions. I will test you more on the organs that are involved in these regions here. But I'm going to mention them just because, again, they might use them in 202. So you've got the right hypochondriac region here and the left hypochondriac region here. Again, these are going to be things that are kind of under the chondra. Chondra is the cartilage of the ribs here. So you can think of the areas where you've got the cartilage. We'll talk about this attaching the ribs to the rib cage, are going to be the organs underneath there. Okay, so that's why they call it the right hypochondriac and then the left hypochondriac region, chondra being the cartilage. Then we can talk about the lumbar regions right below. Again, they're kind of near the lumbar region you can think of your back. So this would be the right lumbar region, left lumbar region. Iliac region is going to be kind of right near your inguinal areas here. So this is the right iliac region, the left iliac region here. And then you've got these central terms. So the umbilical region is easy to think of here in the center, where you would, again, right surrounding the umbilicus or the belly button. Then you have the epigastric region here, which would be kind of where the stomach is, gastric being stomach, and then the hypogastric here being more the pubic region. So again, I mentioned those 9 terms, but like I said, you are much more likely to use these quadrants. And so I will use these 4 quadrants more often when referring, especially to damage to a certain part of the body. And then there are these other body cavities, though, that are smaller cavities that we're really not going to talk about a whole lot because we're going to get into them later on. But they're here. I mentioned them very briefly here, but you don't really need to know them for the exams because we'll get into them a little bit later in the semester here. So please let me know if you have any questions. I know that was quite a bit. All at once. But as you're going through these anatomical terms, please feel free, if you need to, you can set up a chat with me and we can go through these terms on your body. Or if you have a partner, go through those terms with a partner as well. Use your body. Again, we're all, we all like to reference things to ourselves, right? So we're all a little narcissistic, I say. And so if you can learn these terms on your body as well, it makes it a little easier. But of course, it's always nice to practice on someone else because you're going to be referencing another body from anatomical position. All right. So as always, let me know if you have any questions, and we will meet back here for Chemistry Chapter 2.